Nurse TV, brought to you by Hester.
Only gays and IV drug users were being killed by AIDS. But now we know every one of us could be devastated by it.
This confronting commercial is from the 1980s, when the world was attempting to cope with the deadly AIDS virus. The population most affected by this lethal illness was gay men. AIDS devastated the gay community in the 80s and 90s. Then in 1996, the introduction of antiretroviral drugs meant that AIDS became a serious chronic condition rather than a death sentence. Infection rates dropped and it seemed the crisis was over. But in Victoria in 2007, HIV is on the rise in the gay community. Why has this happened, and what is being done to reverse this trend?
We've seen the rates of HIV infection increase slowly but significantly since about 2002. Part of the explanation is about the fact that we've lived with the epidemic for 25 years. There's a bit of weariness about this epidemic. It's had some really negative effects on our lives and on our communities. There's certainly some exhaustion that I see amongst people that have been living in the midst of the epidemic for a long time.
The periodic survey, which is done in Melbourne every year, and a range of other social research says to us we don't see much evidence of complacency. What we do see is gay men saying, we know that every time you have unprotected sex, you're not going to get HIV. It's not like if you put your hand on the iron, you're going to get burnt. What we see people doing is making decisions about how can they live rich and varied sex lives, and how can they, where they're able to, not use condoms. What we're saying people are wrestling with is increased complexity, not complacency. And what we're about is trying to help guys make intelligent and safe choices when they're trying to deal with that complexity.
It has been 20 years since the Grim Reaper campaign taught the Australian public to be terrified of AIDS. Today, HIV infection rates should be under control, but they aren't. Infection rates are rising in every Australian state. The only exception is New South Wales. Why is their HIV infection rate stable? What is New South Wales doing that Victoria isn't?
I think it's fair to say that Victoria is behind New South Wales, but I don't think there's much benefit in doing HIV state of origin.
So much more money was going from the health area into programs and campaigns and research than it happened in Victoria, where we perhaps just took our eye off the ball, I think.
I think we still have enormously committed people working very, very hard in Victoria, but they're doing it with fewer resources.
For example, in terms of employees who are working on HIV policy, there's 6 in the main HIV branch in New South Wales and another 8 in the area health services, which is 14, mostly working on HIV and STIs in gay men. In Victoria, that number's 2 or maybe 3.
The sudden rise of HIV infections in the early 21st century is a complex issue. There are no simple answers. But research has shown that the demographics of HIV-positive people in a particular city can affect the spread of the disease.
A lot of the New South Wales epidemic sits in 2 postcodes. Victoria's is still predominantly in Melbourne, but it's spread more broadly than the Sydney one is, and the Queensland one, when you look at that, because that's the other state we have to factor in, has it spread all over the state. There's also some differences in the HIV positive community. There is a large enough HIV positive community in Sydney for people to have a fair choice of casual sexual partners and say, I'm not interested in having sex with anyone who's not HIV positive. So if you're a positive man in Sydney, you can go out, you can have a rich and varied sex life and only have sex with other people who are HIV positive. That is harder to do in Victoria, and it's even harder still to do in Queensland.
To combat the spread of HIV, some community groups have been looking at popular sex on premises venues and have targeted them in their prevention strategies. But it seems sex on premises venues and casual sex locations, commonly known as beats, are not the riskiest places.
People will have sex regardless. What's the difference between a hotel and us? There's sex in hotels, and hotels don't really provide bottles of lube and condoms by the bedside table, do they? People target us as encouraging unsafe sex, which is highly untrue.
We have signs, we have, condoms and lube at arm's reach. We have current statistics. As soon as you walk in the door, on the right-hand side, you see HIV up 41% and so on. And that's right in your face, right there.
So the most dangerous place to get HIV is in your bedroom or your partner's bedroom. People think that beats or SOPVs are risky. There's no evidence that they are any more risky, and the seroconverter studies around the country, so the interviews that the social researchers have done with people who've acquired HIV, where they invite those people to tell them their story of how they seroconverted, says your own or your partner's bedroom is the site where you are most likely to get HIV.
Armed with extra funding from the government, the Victorian AIDS Council is taking this issue seriously. They are working with a large number of gay community groups, using them as a conduit for their message.
We'll be coming along, working with them and behind them, saying, well, okay, as well as the print media, Joy, billboards, buses and trams, that kind of social marketing, how do we actually roll these programs out around community engagement, around those messages about protecting yourself and your partner?
Despite the rising HIV rate and constant negative comparisons with New South Wales, Victoria's HIV organisations are feeling optimistic.
I think it's really important to remember that what we're doing in Victoria actually is working. If we were in the same situation that we were in the early epidemic, the infection rate would be enormous. There's things we can do better, and we need to turn that around.
The highest risk group are gay men in their 30s. Have they become complacent, or is lack of awareness or simple apathy to blame? The resurgence of HIV is a complex social issue, but in the end, it is up to the individual not to take risks with their health.
Well, gay men can protect themselves from HIV at a very individual level by using condoms for anal sex.
Always treat people who you're having sex with are HIV. You must assume that if a gay man was to not be wearing a condom and having sex, then I suppose it's your prerogative to do that. On the receiving end, if you like to say, you should be aware, why isn't he wearing a condom? Do you want to put yourself at that risk?
For further information about HIV, please visit the Victorian AIDS Council website at vicaids.asn.au.